Good morning, good afternoon, good evening, good night, depending from the location you are watching this video from. Today, I'm going to talk about this medical condition known as sickle cell disease, the sickle cell disorder or sickle cell disease. In my previous video, I talked about the importance of genotypes check before marriage, where I told you the importance whereby this disease known as sickle cell disorder or disease comes as a result of an AS individual marrying an AS individual. For instance, if they have 4 children, if you are an AS and you marry an AS, you will get 1 normal individual and 3 sickling children. And if you are an ASS and you marry SS, all your 4 children will be sicklers. I went as far as advising you all to go and do your genotype check before getting into that marriage proper. If you're into relationship, if you're into courtship, make sure you do your genotypes check before getting into marriage proper to avoid stories that touch the heart in the near future when you have sickling children. Now today, we are going to talk about sickle cell disease. What is sickle cell? Sickle cell is a group of inherited red blood cell disorder. Listen, it's an inherited red blood cell disorder. You know, the components of blood are the red blood cells or the erythrocytes, the white blood cells or the leukocytes, and the platelets. The erythrocytes or the red blood cells are those cells that carry the hemoglobin that carries oxygen that goes or transports it all around the whole body, while the leukocytes or the white blood cells are those that fight against infections. Now, these red blood cells, this hemoglobin that are contained in the red blood cells or the erythrocytes, normally they are round in shape. But in sickle cell disease, this rounded shaped hemoglobin will become like a farm tool, a C-shaped farm tool known as sickle. That C-shaped farm tool known as sickle. Because when this abnormality occurs, the hemoglobin will become hard and sticky, that it will obstruct blood flow through the blood vessels. You know, the blood vessels, the arteries, capillaries, and veins. They will block the blood vessels, leading to a lot of complications and infections. Now, this sickle cell disease, when it manifests in a child, they will be having a lot of pains, joint pains. They are susceptible to various infections like acute chest syndromes, which manifest like dyspnea or difficulty in breathing. There will be tachycardia. There will be a lot of symptoms. And this condition often occurs due to, as I said, due to the sickle shape of that hemoglobin instead of being the normal shape. So it becomes hard and sticky, obstructing blood flow through the vessels. Now, let's talk about how do you diagnose sickle cell disease. First of all, what are the causes? What is the cause of this sickle cell disease? As I said, it's a congenital disorder. What do I mean by congenital disorder? A disorder that is inherited through, and it comes through birth. Is mbrupoto ihe buru lotowa, as the Igbos call it. You came into the world with it because you inherited it both from your parents, from both of your parents. Like I said, the traits in every individual, the person, a child or an individual gets trait both from the father and the mother. In an individual, we have 46 chromosomes, 23 from the father and 23 from the mother, and two of them combine to make up the whole personality of an individual and make up the whole being of that an individual. So if you inherit this trait, either any of your parents is AS and you marry SS, when there's this fertilization of the sperm to the ovum, it will be transferred and you will inherit this sickle cell disease. Diagnosis: how you diagnose this condition. This condition can be diagnosed, one, when the child is inside the womb and when the child has been given birth. When the child is inside the womb, some of the diagnoses that are being carried out are something like chorionic villus sampling, whereby the sample of the placenta is being taken to know, the placenta, that connection between the child and the mother. Or you do what we call amniocentesis, that is extracting some fluid, that fluid surrounding that fetus inside the uterus. You extract some fluid and do the sample test, and you can detect or diagnose this condition. It can equally be diagnosed when the child has been born. For instance, during in normalcy, when a child is born, the pediatrician will do a routine examination of the newborn, right, from the head to the toe. So it is from this examination that they can diagnose this sickle cell disease. Now, what are the signs and symptoms? Like I said, you have acute chest syndrome leading to difficulty in breathing, chest pain, coughing, fever. Then can lead to anemia. That is anemia when there is low oxygen in that hemoglobin in the body. It can be manifested when you have anemia. The person will look pale. You see the fingernails will be yellowish in color. The mucous membrane lines of the mouth, the palms will be yellowish in color. You see, they will be experiencing joint pains, a lot of joint pains in the hip, in the legs, and all the joints will be paining them. Due to what? As a result of that, the blood, due to the hardness of that sickle cell shape, that the hemoglobin become hard and sticky, blood cannot flow again. It will go and block the various organs, leading to insufficient blood supply to those areas. Like in the bones will collapse, and when the bones collapse, that's the reason they have these joint pains. The death of the bone tissues, there will be, if the blood, there's something we call thrombosis. If this the blood clot, when the vessels are blocked, if this vessel reaches the brain and the brain is blocked, it will lead to rupture of the blood vessels of the brain, or ischemia, known as death of the brain tissue. When this occurs, it can land that person to stroke or other conditions. Like if the legs are blocked, the vessels of the legs are blocked, the person will have atrophy of the bone and bone collapse, and the person will start having joint pains. We also, when this occurs, these are the symptoms that you see, and you know that the person is in crisis. These joint pains, the person will be having difficulty in breathing. There will be yellowish colorations of the mucous lines of the lips, the fingernails. The person will look pale because the person has become anemic. So how do you manage this patient? You manage it, one, you know their lifestyle. One, let them be drinking excess water. They will be drinking water always. This water will help to make sure that these blood vessels are not blocked. If they are about to block, the water will help to flush out the clots that have gathered. Then they should Avoid going in areas of high altitudes like flying higher or climbing mountains. They should avoid being exposed to low oxygen level areas. Now, you know that these people are susceptible to infection, so make sure they wash their hands. You wash your, if you are sick, if you have a sickle cell disease, make sure you wash your hands regularly with soap and water. Prepare your food very well. Other the medical condition, they are being transfused with blood. Due to the sickle cell dies quickly, leading to the shortage of blood. That is why they are being transfused regularly, because to meet up with the hemoglobin being normal. So due to the sickle cell dies quickly and easily, the blood is being transfused to them to increase, booster their hemoglobin level. You also give them under the medical management. They are giving intravenous fluid drips, as you know people normally call it. They are giving analgesics, pain relieving drugs, and also hospital admissions. It's not something you go to prayer houses, or it's not something you go to prayer houses. There are medical conditions that need proper medical treatment. Not in every case that what God cannot do does not exist imply. Please, a medical condition is a medical condition, and a spiritual condition is a spiritual condition. Make sure you go to hospital when you have any health issue. Don't depend on spiritual healing every time, going to prayer houses and doing fasting and prayers, whereas it's a medical condition that can be taken care of in the earlier stages. My dear, make haste while the sun shines. So take good care of your health and be healthy. Stay safe, be healthy. Don't depend on prayers every time. Heaven helps those who help themselves. If you go for a hospital checkup and you are diagnosed of any medical condition, follow it medically. To be forewarned is to be forearmed. You get it? Follow me on this page for more. See you in my next video, and stay safe. I love you all. Bye.